Good morning. As mentioned, I'm Chief Sanchez. Today I'll be presenting on food safety in the U.S. Army. One caveat before I get started. Everything in this presentation will reference the U.S. Army. However, we as Veterinary Services provide support and represent all military branches to include Air Force, Marine Corps, Navy, etc. So that is one unique aspect of our job. If there are any questions during this presentation, feel free to stop me along the way, or you can wait until the end. So this is the agenda we'll be covering, going over some objective references, going over the mission, the programs, the two environments that we cover, and then the priorities, and then the roles and responsibilities of what I do, and then I'll leave time for questions at the end. So for the objectives, you will see that we focus on food protection. As we define it, it is food safety and food defense combined. For this presentation, I will only be going into specifics on food safety, as you will get a presentation later this morning from Chief Cavazos on food defense specifically, and then discuss the various food protection programs. I will go over the majority of them. There are a lot of them, which I will not have time to cover everything. And then, as mentioned, the roles and responsibilities of what I do. So these are just some of the references that we use for food protection. And then the Department of Defense directive is kind of what gives us the authority to do what we do. And then the Army regulation kind of lays out what's expected of us. And then all the other guidance is kind of like the how-to, providing guidance to the food inspectors on the ground. And then you'll see towards the bottom, the Technical Guide 376. That is really a step-by-step how-to for the food inspectors to accomplish their mission. These are just some general terms and definitions that you may see throughout this presentation. So anytime we refer to DoD or Department of Defense Veterinary Services, keep in mind that we do encompass the animal health and welfare as well as public health. So we are combined, we do have veterinarians, etc. And so we're one big happy family, but for this purpose, I will only be talking on the food protection piece. So to give you an idea, the DoD Veterinary Services capability encompasses animal health and welfare, veterinary public health. Veterinary public health focuses on the animal health interface with human health and environmental health, and is an essential public health. More specifically, veterinary service consists of the practice of veterinary, including diagnosis and treatment of sick or injured animals, animal health and zoonotic disease surveillance, epidemiology, control and prevention of zoonosis, food protection, management of health aspects of laboratory, animal facilities, and diagnostic laboratories, health education, and it goes on and on and on. And so we specifically focus on food and water. So the term veterinary food inspector, these are the food inspectors on the ground at any military installation. They are enlisted soldiers or civilians that are a member of veterinary services, and they're identified by their job code of a 68R or 68 Romeo, and they inspect various food commodities, operational rations on the military installation, ensuring that we receive that safe, wholesome food for the Department of Defense personnel. So that includes military, civilian, family members, retirees, etc. Veterinary Corps officers are officers, again, that are a member of the Veterinary Corps, and then you'll see all the letters and numbers at the bottom. These are the different MOS or AOCs that we use. And to give you an idea, the 64 Alpha is a field veterinary service officer. Then you have a veterinary preventive medicine officer, veterinary laboratory animal medicine officer, veterinary pathology, veterinary comparative medicine, veterinary clinical medicine officer. And then the last one, which is the 640 Alpha, that is the food safety officer, which is what I am. And then preventive medicine is like our counterparts. So they're not directly related to us, but we do work closely with them. And they have the code of a 68 Sierra, and they perform the food sanitation of all eating establishments on an installation, but they do not include retail stores. And so the retail stores we refer to as our commissary or grocery store, our exchanges, which are gas stations, mini marts, etc. And so there's a clear separation of what we do as veterinary services and what they do as preventive medicine. So I like to think of it as we do from raw material receiving through storage, and then preventive medicine takes over once the product is made and getting sold or consumed by someone. So that kind of gives you an idea. So mission is to ensure service members, family, DoD civilians, and retirees have access to unadulterated food. And ultimately, we are protecting the financial interests of the government to the best of our abilities. These are just some of the programs that we have. So subsistence recalls, very similar to FDA type. We use that as surveillance. We have food defense, which as mentioned will be covered later. Receipt inspections, surveillance inspections, approved source verification, sanitation inspection of our military facilities. We have what we refer to as veterinary installation support, which I'll talk about, destination monitoring, and then food protection audits of commercial food establishments, and then food and water risk assessments. So for this presentation, I will break down each one of these with a little bit more detail. Our two environments that we separate the mission into. We have on the installation, which would be on the military post, whatever you would call it, base, and then we have the off installation support. So you'll see each program is broken up into the different areas. The main focus of the food safety officer, as you'll see at the bottom, is the food protection audits of commercial food establishments, which when I get to that, I'll go into a lot more detail. And then also our food and water risk assessments. So the recalls is just the Department of Defense's own system internally that we use to communicate any recalls that may be going on. We gather all the information, as you see, from the FDA, USDA, etc. And we do have a DLA, or Defense Logistics Agency Support Consumer Safety Officer, that's responsible for coordinating these recalls and pushing them out to us, so we can go into all of our military food establishments and make sure that we do not have these recalled products. This is one of the food inspector's highest priorities based on the public health risk. And so if there were any intentional food contamination, they would address that first, but then recalls would be second. And they are given a 72-hour time frame to check all facilities and post a response of what that recall may entail. So for food defense, this is just a general overview. It's necessary to identify and mitigate threat or intentional contamination of food. It aids the anti-terrorism officer in mitigating food defense concerns on the installation. And it's also part of the anti-terrorism program. And the personnel that are responsible for running this program have to be specifically trained on appointment orders by the commander, so they know this is somewhat of an additional duty that they have to fulfill on top of their normal duty. And it's integrated into our day-to-day operations on the installation. And food defense is addressed during every visit at every facility that the food inspectors go to. So receipt inspections, this is one of the highest priorities as well. As you will see, these occur when food is delivered to the facility, and it's the last inspection that's conducted before the government takes ownership of that food. And so it's very important that the food inspectors identify any potential concerns at that time so they can make recommendations to either reject the food, accept it at a lower cost, whatever the case may be. And it ensures compliance with requirements of approved sources, sanitation, wholesomeness. And then you'll see some reasons of why they could reject whatever is coming in. And so it could be anything from contractual requirements to contamination, pest problems, unwholesomeness, expired product, etc. So it's very important that the food inspectors are there when trucks are received, so they can aid the facilities in making the determination if they should accept the product or not. So surveillance inspections occur once the government owns the product. So this would be the next step. So once they receive it, it's in storage, maybe in a cooler, in a freezer, in a warehouse. And then the food inspectors have to go around periodically and make sure that that product still in storage is still wholesome and suitable for further storage, issue, sale, or consumption. This also includes operational rations, like your meals ready to eat, all those different types of things that we deal with. And they do focus on those infestable items such as pet food, your grains, rices, etc. They do look for the factors when making their determinations or their recommendations of if this product is still suitable or not. And some of those may include deterioration or spoilage, whether it's been exposed to anything, how it's being stored, and then any potential rodent problems that they may have occurred during storage. So approved source verification. So what we do as the Department of Defense is we ensure that all products received on our installation that Department of Defense personnel will be consuming are coming from what we refer to as an approved source. And there's an elaborate definition of what this entails, but it's a risk-based approach to determine those high-risk food items that we require to have some sort of inspection. So whether that be by a federal entity such as the USDA, FDA, USDC, etc., or by us internally, then this is what feeds into this program. And so all facilities that we audit as the Department of Defense, we maintain a circular, as you'll see, the Worldwide Directory of Sanitarily Approved Food Establishments for Armed Forces Procurement. And what this does is this lists all the products that we go to those facilities and audit. So when the food inspectors are doing their checks in their food facilities, they can pick up an item and look at a code and tie it back to the actual plant that it's made at. There are some criteria where products may be exempt, and that again is based off of risk base that's done at a higher level. And there is the link for public access to certain information. In a follow-on slide, I'll show you what that would look like. And so the reason they do this is to verify that the food items that we are receiving have gone through some sort of check or inspection or audit, if you will. And then what feeds this program is our commercial food protection audits, which I'll discuss later. And if there ever were any sources identified as unapproved, meaning they can't find where it's made from, or they don't know if it's been inspected or not, it's not approved by the USDA, FDA, USDC, we don't audit the plant, then there's a whole nother process that they go through to submit what they found, and then a risk assessment is done by myself to determine if we could still sell this product or if that plant may need to request an audit from us. So this is kind of what it looks like. And so if they were to go into our database with that link that was provided on the previous slide, we would get this description like you see in the background. So in this case, Grimway Farms. So they found some cut and peeled baby carrots at our grocery store. And they see a code on the back, because with a lot of products, we know that they like to code stuff. They don't put stuff as open codes, it's all closed codes. And so looking at this, they see a code of Papa Alpha within some numbers. And so we were able to track this product down by contacting the Grimway Farms out of California, which we do audit. And so when they looked this up in our circular, they found Grimway Farms in California. But then if you notice, the codes that are provided with red arrow have a Bravo Foxtrot or a Sierra Papa at the end of the date. Well, the one that our food inspectors found have Papa Alpha, which does not match. So in this case, this would be considered an unapproved item, and we would have to do a risk-based analysis on it to determine if we can keep this within our retail grocery store, and or if Grimway Farms, wherever this product is being made, they would like to request a military audit. So this particular plant is actually in Washington. So this fell under my purview, so I'm still monitoring this product very closely. The next one is our sanitation inspection of military food facilities. And so what happens is food inspectors are within our grocery stores, within our shopettes or our gas stations. They go to our food courts, so Subway, Anthony's Pizza, all these different restaurants that we have, our dining facilities, so anywhere that they may eat. And so with sanitary inspections, this pertains specifically to our commissary grocery stores and our exchange facilities. Because as mentioned during the introduction, preventive medicine is responsible for all of those other entities like the food courts, the Subways, the Burger Kings, etc. And so what we do is we inspect our commissaries and our exchanges or our gas stations in accordance with the Tri-Service Food Code. It is an adopted version of the FDA's food code. However, it is combined for military specific. And we refer to this as the TB Med 530 or Technical Medical Bulletin, or Tri-Service Food Code for short. We also review pest management. And these are required on a monthly basis by specific personnel. So as you will see, they can be a veterinary corps officer, can be a non-commissioned officer or enlisted food inspector. They can also be a civilian equivalent or a veterinary medical officer. And then once they do these inspections, we have to log them into a separate database. And the report does get reported to higher headquarters as needed, especially if they were to receive an unsatisfactory rating or something of that sort. This is the form that we use to do our formal military sanitary inspections. It is based off of each chapter of the Tri-Service Food Code. So it is in order by chapter. And then we kind of take this around with us to keep on track and to see what we see. And then we have to look up the provision that may be applicable. And then we go back and we type it into our system. This is the back of the report. So we do have some additional requirements that you will see on here. We do have to include temperature observations, whether that be of food items or locations. So coolers, freezers, hot rollers. So if they're doing like self-serve hot dogs or something like that, like they would at a convenience store, it's very similar on a military installation. We also look at the sanitizing component. So we look at dishwasher temperature, chemical concentrations, whether it be chlorine or quat, and we do annotate what that may look like. And then at the bottom, under block 18, the remarks section, this is where we would list each specific item number, and we would cite the applicable provision. We would put what our finding was, and then we also provide a recommendation. One of the main big differences is that on a military installation, we always do our best to assist that food facility accountable officer or manager in charge on how we can fix this going forward. So we never want them to feel that we're against them, we're writing them up for something. We always provide that guidance and that training to them, which is opposite when we do off installation support with our commercial food protection audits, where we are not allowed to provide recommendations. And so they would receive a copy of this so they could go back and make their corrections before the next inspection the following month. So veterinary installation support. This is one of the biggest programs that we have. So it is established under the authority of the Surgeon General, and we provide regular assessments regarding food protection and quality of food on the installation. So this is applicable to all installations within medical command area of responsibility. And so this does entail Navy, Marine Corps, Army, Air Force, you name it, we are there. It's a direct interaction inspection of food at on installation facilities. And then you'll see the different agencies that we do support. So our DECA commissary or Defense Commissary Agency, which is our grocery stores. And then we have our exchange services, which could be our gas station, mini marts, just think of like a convenience store. And then we have our morale, welfare, and recreation, which would be anything to build morale on the installation. So whether it be bowling alleys, daycare centers, clubs, that sort of thing. And then we have our troop feeding, which is our dining facilities, storage warehouse for our rations. And so this is where the food inspectors spend a lot of their time to ensure that safe food is being given to DoD personnel. This is just some of the support they provide at each of these agencies and or facilities. So you'll see, again, it's kind of all incorporated because you'll see recalls again. Also deal with any hazardous conditions such as refrigeration failures, which I'll give you a definition of in a second. And then approved sources, they verify, they deal with customer complaints, they do the receipt inspections when the trucks come in and deliver subsistence. They do those surveillance inspections once the product is already in storage. They can also do farmers market support. And so we do authorize farmers markets on installations if approved by the installation commander. Food defense again, and then we do have our own laboratory sampling program that we can implement if need be. Military sanitary inspections, we deal with donated foods. So whether we are the one donating or receiving donated foods. And then we do rapid surface testing methods. And so we do ATP testing within our processing areas of our retail grocery stores. So like our produce department, meat department, we do go in there and swab with the Naval just to see how their sanitation practices are going. And we also do a HACCP review, or Hazard Analysis Critical Control Point, of any of our specialty areas like our sushi department or our rotisserie chickens, to make sure that they are abiding by their critical control points, and then identifying any potential concerns with their verification or validation processes also. As you'll see, food inspectors receive a wide variety of training, and they are very knowledgeable in each of these different categories, and everything that they do is on a frequency. And so they may do some of these more frequent than others, and then they may be told to do some of these as well. So one of our next programs is what we refer to as Destination Monitoring Program. And so what this is, it's a lab sampling program where specific commodities, food commodities, are sent to our diagnostic laboratory, mainly in Texas. We do have additional ones in Europe, Korea. There's another one in Hawaii. And so we are told essentially what commodities they would like to test. So to give you an example, last month we were tasked with sending in pouched tuna, fruit juices, leafy green salad kits, dairy, and then we also had to do environmental sponge samples, or sponge sticks, which are very similar to what the FDA uses. And so we go within our grocery stores and we pull those items. We could also pull them from our gas stations, our food courts, whatever the case may be. And then when it's environmental specific, we pull those from our processing departments of our grocery store, just to kind of get an indication of what is going on. And so this could also be based on public health risks that they may have identified of what commodities to tell us to send them. And so you'll see examples. It could be based off recalls, emergent public health risks, or just something that they're interested in testing. So this is done at all of our military facilities on an installation. And right now it's on a quarterly frequency. Every 3 months we do pull samples and send it into our laboratory. And then as mentioned, we do that environmental piece. We do test deli, sushi, meat, produce departments. We could also pull environmental samples during our commercial food protection audits as well, off of zone 1s or food contact surfaces if need be. And we do test for Listeria, Salmonella, and E. coli. And if there were ever any positive results, then there are some follow-ups that we would have to do to determine if product is adulterated or not, or if it's of concern or not, depending on which zones may have tested positive. We do test zones 1, 2, and 3 in our retail grocery stores, which is the same. We could do 1 through 4 with our food protection audits if need be. And then if and when we do receive these positive results as part of an audit, we could share those results, or we're obligated to share those results with the FDA, which could in turn lead to a joint inspection, potential recall, etc. So as mentioned already, we do sample for Listeria, Salmonella, and E. coli. We use the sponge stick 10 ml with neutralizing buffer. For on-installation support, we only focus on zones 1 through 3. I already talked about the different departments that we swab. And then for a food protection audit, this is something we would have to be told to do essentially. So there would have to be reason. We wouldn't just go in and start swabbing. So this could be part of an initial audit of a facility that has not been selling to the government yet, but would like to. It could be part of a directed routine audit, which may have failed a previous audit or maybe some concerns going on, or a special audit, which is the most severe, which means they have a lot going on that we need to identify potential public health concerns. If we were to pull these as part of a commercial food protection audit, they would be included in our tasker to the auditor, so we would know ahead of time to prepare and make sure that we take necessary supplies and equipment with us. And we would only focus on those areas of concern. So this is the big one, which are our food protection audits. So systemic independent document examination, we do a variety of things. So we do documentation review, we may interview employees, review practices. We also observe production, sanitation, pre-operational inspections. So whatever that facility may be doing, we would want to see it. part of that, we could pull those samples as discussed and send those to our lab for testing. To give you an idea, we currently conduct at over 2,000 commercial facilities in nearly 100 countries in every state and territory. So even though we're not stationed in these specific locations, we do travel quite a lot or quite a bit to ensure that we can cover all of these different countries. And this supports the purchase of subsistence or contracts. And so a lot of times what happens is maybe units want to buy something. Well, in order to get that money, they're obligated to buy from approved sources or those facilities that either we audit or those federal agencies audit. This program is managed by the Army Public Health Center, which is our highest headquarters, I guess you could say, again, under the Surgeon General. And we audit them using what we refer to as the Military Standard 3006 guidelines. And currently, everything that we're doing for our audits are based off the 21 Code of Federal Regulation Part 110. We are in the process of transitioning to Part 117 to mirror FSMA requirements. We're just not quite there yet. You'll see our 4 different types of audits. We have initial, routine, directed routine, and special. So initial would be those up and coming facilities that want to start selling to the government. A routine is once they're already selling, they would be audited on an annual frequency or more frequent if necessary. Directed routine, as mentioned, would be if maybe something happened during a routine and we need to do a follow-up. And then a special would be that they failed a directed routine, and this is kind of like their last straw to see if they want to stay listed to sell to the government or no, we're not going to deal with you anymore, and then we delist them. And they would no longer be able to sell at that time until they could fix all those potential deficiencies or public health concerns that we've identified during previous audits. These are conducted by trained and certified auditors, which we have approximately 600 in our inventory right now. So these are all of your veterinary corps officers, which was that breakdown I gave you at the beginning, as well as your 640 alphas or your food safety officers. We do have civilians as well, if they are trained and meet the appropriate certification. As mentioned, everything is on an annual frequency is what we're trying to get to. Do I have any questions so far? No? All right. So food and water risk assessments, this is kind of a unique one. So the reason or the intent of these is to assess food operations and identify, mitigate risk from intentional and unintentional contamination. We only conduct these at overseas locations. They are not something that we do in the continental US. And these are some of the reasons they may be required to be conducted. So maybe we're in a location where we don't have access to the approved sources that we've identified, or it could be a short mission, a short deployment, maybe a lack of food logistics support in the area. So maybe a deploying area that nobody has been in before and they're trying to establish something, or again, for an exercise, what have you. So let me see, I see some questions. Oh, that's about a survey, never mind. So required activities using funding. And so what happens is, in order to get that funding released, they have to abide by certain protocol. And so these locations that may be identified to feed personnel in a specific area for a specific time or mission, we would want to go and inspect that kitchen or that restaurant to make sure there's somewhat, they're not going to be to US standard, I'll give you that, but to some standard, or at least we could identify some mitigating factors, some recommendations before either our troops or our civilians are going to be eating from there. And so it could be feeding locations, catering, it could be forward operating bases, national food facilities, so if you're overseas, or even host nation. And again, you have to receive specific training and certification to conduct these. And so the intent is you would go in and you essentially inspect the facility as you would like the Tri-Service Food Code to make sure they're meeting just basic sanitary conditions. And then you would also sample water to test for coliform and E. coli. So it gives us an indication of what we're potentially looking at. So whether they're using that water to wash produce or make product, whatever the case may be. And we would always recommend that for military purposes, they would be provided bottled water. They wouldn't want to necessarily drink the tap water because of potability standard. So I was given the opportunity to conduct food and water risk assessments this year in the Philippines. And so I went for about 2 weeks and I pulled 52 water samples to test for coliform and E. coli. And I did 15 food and water risk assessments. So the goal is that you always do 3 facilities in each location that you're at. So that gives the commander an option to choose from. So all you're there doing is you're the person on the ground gathering the information, identifying those public health concerns, and you provide that information up, and then ultimately they are responsible for picking which facility they want to cater or feed personnel that are there for that mission. So it's very eye-opening. You do see things that you would not see in the US, that maybe you're used to certain protocol or standards of what our general practices are. It's not the same in any other country, I'll tell you that. So this kind of breaks down the priorities. This is just a model. It's not set in stone. It does not have to be this way. It's just guidance. And so again, you'll see that on installation and off installation support. And then that red circle in the middle would be the immediate public health risks that we're concerned with, which you'll see in the red box. So as mentioned at the beginning, you have your intentional food contamination. They would always address that first, followed by your recalls, and then refrigeration failures. I know I did not go too much into this, but to give you a quick definition. And so what happens is if our facilities have a power outage or maybe a mechanical breakdown of the refrigeration or freezer units, and so we would go and do an assessment on those items and see if they can be saved, consumed, or if they would have to be discarded. And so everything is a risk-based approach, and they follow guidelines, and we have some what we call safe items, which would be of no public health concern. And so the food inspectors go through and they separate all these different commodities, and they try to save the government money and allow those items to still be sold if there's no public health risk involved. And so that's essentially what a refrigeration failure is. So time is very important with that, because with time or temperature sensitive foods, we don't want over that 4-hour mark to go by at high temperatures before they can address and try to get those products saved if possible. And then we have our imminent health hazards if found during our military sanitary inspections, which are those once a month. And then if we had any laboratory results come back positive with any public health concerns. And then you also see disaster relief support on there. And so if need be, we do get involved with that. And then foodborne illness outbreak support. We work closely with preventive medicine and the installation with any foodborne illness outbreak support, but we are capable of sending items to our laboratory for testing if need be. We can interview personnel, etc. So I do see a question in the chat. What were some of the issues that you saw in the Philippines? So there's a variety. If I would say out of all the facilities, 2, they knew how to properly wash produce. So actually using a sanitizing solution. Everybody else just used the water out of the faucet. The concern with that is the ones that were just using the water out of the faucet, that water was not potable. So it did have coliform E. coli in it. And so what we did as the military is we exempted those items, meaning we would recommend that if they do choose this facility to eat at, don't serve cut up fruits and vegetables, only serve whole fruits and vegetables like apples, oranges, bananas, not like your cantaloupe, watermelon, etc., because we didn't want to jeopardize that. Another big one was just no general knowledge of cross-contamination. And so they would use the same cutting board for everything. They would only have one cutting board. And then maybe that cutting board was even just made of wood. And so they don't really understand the significance. They would just rinse it off and go on to the next product, whether it was raw or cooked or not. And so a lot of their kitchens are open to the environment. And so they do just have maybe a screen on there, maybe no screen. And so you're worried about those environmental contaminants as well, where in the US, we would see a facility where you could easily clean the floors, the walls, the ceilings, etc. That was not the case in the Philippines. So it's definitely eye-opening. Yes, I did eat at some maybe sketchy places. I did not get sick, which was the good thing. And I only drank bottled water while I was there. So going back to the model here, you'll see for installation support down in the lower left for the green, you'll see operational rations are number 1 support. And this would be your meals ready to eat, those rations that are going to go with those troops that maybe deploy. And so those always have to be readily available. And you'll see the different programs we discussed: receipt inspections, military sanitary inspections, ISP visits, the destination monitoring. And then again, on the bottom right, you'll see the off installation, which is all of your food protection audits in that specific order. So we would prioritize if we focus on directed, initial, special, etc. And then our food and water risk assessments would be last. So what do I do as the food safety officer? So specialized in food safety and defense, selected by a competitive application process as discussed during the introduction. And so there's only 2 MOSs that can feed into food safety, which are your 68 Romeos or your food inspection specialists, or your 68 Sierras preventive medicine. So maybe they join as enlisted in one of those MOSs, and later on in their career, they decide they want to apply to become a warrant officer, specifically food safety. They would submit an application with all the applicable requirements, and then they hold a board and only select a certain number of personnel per year. And so that is how you become what I am today. And then you go through additional specialized training, and it's ongoing and continuous learning process. So I advise the commander for anything and everything regarding food safety and defense. So whether this be on the installation, off the installation, anything pertaining to food safety and defense, the commander is going to come to me and say, ma'am, what do you think? What are your recommendations? What should we do? And I have to advise that commander on what is the best practice at that time. I'm also responsible for managing all the food protection programs. So as you'll see during this presentation, I did discuss multiple programs. And so making sure that each of those programs is running as it should be, then I have to monitor all of these and make sure that if we do find any deficiencies or maybe need to focus in one area, not so much in another, I have to get all the soldiers on track to make sure that they're focusing on the programs that they should be. I also provide guidance and technical advice to the food inspectors on anything and everything that they may have questions on during their inspections, things that they may see. I also do the unapproved risk assessments for unapproved sources. And then I also provide training as needed. So I do go out to their locations. I could provide one-on-one training with them, local, like a section training with just a few soldiers, up into the whole unit with 50, 60 plus personnel. And so we try to do that at least once a year. So it's direct interaction with myself and the soldiers. And then we also interface with all of those federal entities. So federal, state, county, local, etc. And so we do try to collaborate and get on good working relationships. And if we can do any sort of joint inspections in our area, we do try our best to do that as well. And anything pertaining to food safety, food defense, and quality assurance. Do I have any questions?
Thank you, Chief Sanchez. It doesn't look like we have any new questions. There was a question back a couple. Do Air Force and Naval bases have similar staff and protocol?
So, great question. So what ends up happening, which is kind of unique, and so Air Force is kind of one of those entities where we don't really get involved unless it is a joint base. So to give you an example, here in Washington where I'm at, we used to have McCord Air Force Base and Fort Lewis. About 10 years ago, they merged together and now it's Joint Base Lewis McCord. So when that happened, the Army took over the Air Force mission. And so that is not always the case at every location. And so in this case, we do the food inspection on the Air Force side and the Army side. However, if it's an Air Force location that we do not have any jurisdiction in, it's run by the Air Force, they do have their own equivalent, but theirs is kind of a preventive medicine food inspection tied together. So they don't have a specific job just for food, if that answers your question. And then for Navy, we do all the inspection for Navy. So you'll always see Army food inspectors on Navy inspections. So another question, are the restaurants on base such as Burger King inspected by us? So yes, not inspected by me specifically, but by the food inspectors. So anything and everything that sells or prepares food on a military installation gets inspected by a food inspector. Again, it's based on a frequency. So those types of facilities are done once a month. But anything that you could think of from, like I said, your gas stations to your food courts with your Burger King, Subways, etc. It even goes into, trying to think of unique ones. So our bowling alleys, anything that may serve food, we inspect. Even if it's just a warehouse that's storing food, we still inspect that as well.